We are inside the left ventricle, monitoring volume of blood and pressure changes. We are going to see what happened to the heart while we are there.
We start at point 4, when we got the mitral valve opens. Blood starts to flow from left atrium to left ventricle. So, the left ventricular volume starts to increase. This phase of ventricular filling is associated with gradual increase in ventricular pressure. The aortic valve is closed. Also, the pulmonary valve on the right side of the heart is closed too.
When pressure on left ventricle becomes more than that of the left atrium, the mitral valve closes to prevent backflow of blood. This happens at point 1. Closure of the mitral and tricuspid valves is responsible for production of the first heart sound.
After point 1, the heart starts to contract. The period from 1 and 2 is called the isovolumic isometric contraction. It is called isovolumic because ventricular volume does not change. All heart valves are closed during this period.
Cardiac contraction greatly increases the pressure inside the ventricle. When ventricular pressure exceeds the aortic pressure, the aortic valve opens. This happens at point 2. After this point, blood starts to flow from the left ventricle to the aorta. The same thing happens on the right heart, where blood flows from the right ventricle to the pulmonary circulation.
The heart continues in contraction from point 2 to 3. The volume is decreasing. It is the period of ventricular emptying. Eventually, at point 3, the aortic pressure becomes high, and the aortic valve closes. This produces the audible second heart sound.
Finally, from 3 to 4 is the period of isometric relaxation. All valves are closed. The ventricles are relaxing. At point 4, the mitral and tricuspid valves open again to repeat the cycle.